Good afternoon. While Colin's setting up, I'll do a quick introduction about myself. I am, as Winston was saying, I'm a community development manager, and so I've been doing this work for over a decade, and it was actually at East Bay Asian Local Development Corporation, another nonprofit in Oakland that does community development work. And so the work that we're doing at MEDA, Mission Economic Development Agency, is the connection of community development and family economic success around financial empowerment. And as I go through the Mission Promise neighborhood, which we're one of 12 grantees, and thank you very much, Policy Link, for initiating this federally through the Harlem Children's Zone and really connecting what needs to be a national effort around academic achievement for our children in our communities. Mission Promise neighborhood. I'm going to go through MEDA very quickly. MEDA has been in the Mission District in San Francisco, which is primarily Latino, for the last 40 years. So we have deep roots in the neighborhood. And I bring this up because as I'm talking, I think part of today's conversation has been very high level and sort of going a little bit deeper into the weeds of how this work actually gets done in the neighborhood. And our primary goal for the last 40 years has really been achieving economic justice for San Francisco's low and moderate income Latino families through asset development. Last year, we received the Mission Promise Neighborhood grant to implement a Promise Neighborhood in the Mission, and I'll go over what a Promise Neighborhood is, but the highlights of the framework for the Promise Neighborhood that we propose for the Mission District in San Francisco is that it has to be culturally relevant and it's place-based. We're focusing as our goals on the academic achievement of our children and also on the family economic success, which, unlike other Promise neighborhoods in the country, is key. We believe if you don't alleviate poverty, and we've talked about this a lot today, if you don't change the income levels of the families and really help them to build assets, you're not going to change a lot of the other futures of their children. A service integration model that connects what we're doing with our partners and also starts building more collective impact instead of just one agency doing the work. And most importantly, doing this evidence-based. I think a lot of the challenges that community-based organizations have is how do we start showing that our work actually does work? And unfortunately, a lot of times it sounds like it's a lot of stories, but not evidence-based. So why MEDA? MEDA has been in the community, as I said, for over 40 years in service to the Mission District. We started primarily in building family economic success by providing business coaching services and financial capability for our residents in the Mission District. And then we built into having an actual building, Plaza Adelante, which I'll talk about a little bit more, and actually embracing a United Way model called the Spark Point model. So we have a history of success in community planning and sort of building a cross-sector network of partners that isn't just in economic development. And of course, we're very good at raising funds, which, as Tony was saying, is actually very important. If we can't bring funding into our community, then a lot of the work that we do gets limited to just our particular agency. The Mission Promise neighborhood specifically is focused on children's success and the family success. And so what we're trying to do with Promise neighborhoods across the country is to start building neighborhoods where the families and the children are the focus and where we can, specifically for the Mission Promise neighborhood, have a healthy and safe community that allows people to call San Francisco home, which is very critical in San Francisco, as some of you might have heard, because we have a really high rate of our families being pushed out due to the high prices of our homes. So just to give you a sense of it, Mission Promise neighborhood is in the San Francisco around, if any of you know San Francisco, around the 16th Street and 24th Street BART stations. It didn't show up, but essentially the size of the area is around, oh, well, it didn't show up, but anyway, it's a size of about 20 blocks, 20 city blocks, and 57,000 people. The Mission itself has a diverse population. 40% of the Mission's residents are foreign-born, and 41% are Latino. This is despite the fact that this has actually been decreasing over time as residents have been forced to move out due to high housing prices. On the other hand, we're seeing that the mission, despite the fact that there's a very high Latino population, the incomes are actually significantly different from other populations in the neighborhood. In the mission, the median income is $67,000. Latinos, their median income is $43,000 compared to other populations in the neighborhood. So already starting to see the disparities in income in the neighborhood, despite the fact that this is the population that represents a huge proportion of the neighborhood. Health-wise, we see the same sort of disparities with our population. A third of what's considered Mission Promise neighborhood students do not have a medical home. First and second graders are least likely to have access. And only 22% of Mission Promise neighborhood students are considered in a healthy range for their age and height. And of course, of these Mission Promise neighborhood, a high percentage of them are Latino students. So we're seeing sort of this correlation between poverty and health, and there are a lot of other things that we also correlate through the Mission Promise neighborhood. Their academic achievement is low, and their access to technology is low, and so we're starting to see sort of like a correlation of a lot of different factors that relate to single types of population in the mission. So our goal and role with Mission Promise Neighborhood then is to how do we change this dynamic? How do we change this from great, we know what the context is, but how do we actually change it? And with MEDA's involvement, we said let's change this through family economic security. If we can help our families learn how to become better savers, learn how to budget, learn how to really take control of their financial futures, then they can then build better futures for their children. So how we're doing this is we're doing this in the right language. If it's not culturally relevant, then you know, it's great to say that we'd like to have a lot of our kids involved in this, but if we don't do this in a way that really is appropriate for our families, then it doesn't work. It's also based on needs-based and evidence-based services. And the last is service integration, which I'll talk about in a bit. But essentially, this is our wheel. This is our framework of how we're looking at this. And so it's very holistic. As I was saying earlier, at the middle is academic achievement and economic success as the center of it. But we look at all the different strategies that it takes to make this happen. And we don't do this alone. We have 26 partners who are making this work. And the intent is we start from these goals and we have our strategies to do the direct services. But beyond that, we have universal services that everybody has to get. Everybody has to have English as a second language. Everybody has to have benefit screening. Everybody has to get legal services. And then beyond that, we're working with all of our partners in each one of these strategies to then work on the outer ring, which is the systems change. We're working on joint communications. How do we talk about our work collectively? How do we engage our families collectively? How do we do data systems collectively? So I think I'm probably running out of time. Okay, so, and this is what I talked about really quickly. And this is our list. We have 26 partners, and they range across sectors. We have the Department of Public Health. We have the Mayor's Office. We have City College of San Francisco. We also have the John Gardner Center from Stanford helping us to do data evaluation. And then we have all of our service partners throughout the community. So we're very deep in sort of all the different sectors that can make this work. So I'm going to give a very specific example of what does this mean. So what does that mean when I say service integration, and what does family economic success means? For MEDA, and this is what MEDA is doing in this work, it means that we look at all the different things that affect a family. How do you do your taxes? If you were interested in getting a business started, how do you do that? And how do you become a homeowner? All that requires that you have financial capability and have financial education. But then that also requires that if you come into our agency and are interested in tax services, we don't just say, great, you've done your taxes, you walk away. We actually say, you're interested in tax services, but let us talk you through some of your other challenges that you may have. And this is then something that we then go through with our other partners. So our other partners are doing the same thing, where a question of like, well, I'm actually also worried because my landlord is actually not keeping the heat on it. It's winter time. What do I do? And so then we refer them to our other partners. So there's a common intake, and that's very important that we're crossing sectors and saying, hey, you know, I'm not just here for your tax problems. I'm not just here for your financial problems. I'm also here to help you to figure out how your kid can do well. And so if you have challenges with your kids and their mental health issues, then we have other partners that we can connect you to. And then as partners, we're all sharing our evaluation of who we're tracking, so that the ideal is that we're actually then going to see how our students are doing across the different services that they may receive from us. So where this shows up is in our hubs, and Plaza Adelante is one of our hubs, which is a building that MEDA built, and it includes ourselves, a tech center where people again can come in for computer services, but then ultimately get financial education services, get services with causa justa around their tenants' rights. But this is also happening in our schools. So because Promise Neighborhoods is about schools, we have 4 schools that have traditionally been the lowest performing in the state, and they've also received school improvement grants. So in each of these schools, we've placed family success coaches that are doing the same thing, helping families to navigate the system and also both gain family economic success, but ultimately figure out, well, how else can I navigate the system? Okay, so and then lastly is we have to measure this, because if we don't measure it, then the funder's not going to fund us, and then we can't continue doing our work. And this is a real quick diagram of how we've measured it. So again, highlights is that that the model has to be culturally relevant and it has to be place-based. If it's not, people identify with the fact that they're living in the mission and that this is their home. And so what we're doing is also helping them to stay in their home and their neighborhood. The primary goals are academic achievement or changing health outcomes, but frankly, if you're not changing their ability to do better in their lives with family economic success, it's very hard for them to do better. And I think Tony was talking about this with personal responsibility. It's very hard if you don't have the assets to be able to take that on. We're doing this with our other partners through service integration, and ultimately realizing that we can't do this alone. There has to be collective impact. And we're building our own evidence-based strategies by adding evidence with collective evaluation. Thank you.
So I'm going to invite Duran from ICEA to come up, and I just have to remind you about the tyranny of the lights here.
Okay.
The tyranny of the lights is green, and in yellow you have 2 minutes, and in red it's time's up.
Okay. All right.